Here we are on the couch with Nicki Wilson. Nicki's from EDANS. Nicki, tell us about EDANS.
EDANS is the Eating Disorders Association of New Zealand. We are an organisation that provides support to carers of people with eating disorders. We also have a role in educating families, the members of the community who have an interest in supporting people and caring for those with eating disorders. Particular interest in educating GPs, primary health care providers, because they have such an important role to play in detecting, diagnosing and setting people on the path to treatment.
And that's what you've been doing tonight?
Yep, I have.
People who are going to be watching this clip are going to be wanting to know the take-home points of what you talked about today. So what are the things that are important with a GP? For
a GP, I think the points I'd like to make are that eating disorders are treatable. It is possible to recover from an eating disorder.
So why do you say that? I mean, that's do some people think it's not?
Yes.
Okay.
Yeah. People say, oh well, that you never get over that, do you? Or once you've got an eating disorder, you've got one for life, sort of thing.
So detectable when? What age does eating disorders start?
Oh, eating disorders can occur at any age. While they do typically affect, they do perhaps come about mostly in teenage girls, and that's a known fact. Mm-hmm. What isn't known is that they also affect males, and increasingly males are being diagnosed. At the moment it's believed that 10% of sufferers of eating disorders are male, but that number is actually increasing. They affect people of all ages. Mm-hmm. So onset can be as young as 8 and certainly older people as well.
Mm-hmm. So GPs picking that up on the earliest possible stages
is really, really important for the best recovery. Mm.
So people coming with other non-related eating, may not be a primary condition turning up for, but if they dig deep enough, they're going to be able to see behind that? Yeah,
well, we do want GPs to be thinking about eating disorders when somebody presents who has lost weight or who is showing signs of disordered eating or has concerns about their own size and shape that may be misplaced, that a GP could pick up on. And particularly if parents are coming along, or others who present with their loved one and are saying, I'm concerned that this person has an eating disorder, we want GPs to take notice of that and to listen.
So I imagine that everyone working together, because it's not just I've got a cough, here's some antibiotics, go away. It's not as simple as that, is it?
No, it's collaboration actually is really important. You've hit the nail on the head. So important for the GP to work with the caregiver. So if it's a parent who is coming along with a young person that they're worried about, for the GP to first and foremost listen to them and take their concerns seriously, and to work with them to form a support team that the patient can trust.
So what are the typical treatment?
Well, for anorexia nervosa, the evidence-based treatment is FBT, or GPs might have heard of Maudsley, and FBT stands for family-based treatment. So the Maudsley family-based treatment is the evidence-based treatment for anorexia nervosa. In the case of bulimia nervosa and also binge eating disorder, CBT, cognitive behavioural therapy, is recommended and is shown to have good effect. One of the really important things for a GP to realise is that food is medicine for all eating disorders, and what we're talking about is regular, sufficient nutrition provided and supported for the patient to get back to normal eating sufficiently. Mm-hmm. So food is medicine, particularly for anorexia nervosa. Restoration of weight is number one.
Mm-hmm. Nicki, the best way to contact EDANS is what?
We have an 0800 number, 0800 2 EDANS. We also have a website, which is www.ed.org.nz.
Thank you very much for your time tonight.
Thank you.